reconstructive surgeon. We are here at Pure Plastic Surgery in Miami, Florida. You can check us out online at pureplasticsurgery.com or our Instagrams and TikToks and all the different places. But please go check out our website as well. That's where you can see before and after pictures. You can get a lot more information. We have a lot of these previously recorded videos that gives a lot of information for our patients to make informed decisions. Today we're going to be giving a little bit of love to our male patients, and we're going to be talking about a procedure specific for our male patients. It's not quite as common as women getting plastic surgery, but it's becoming much more common, and plastic surgery is one of the fastest growing sectors, is men getting plastic surgery. So this is not just for the women, this is for the men as well. You should be comfortable in your body, and we can help you achieve some of those goals depending on what you have going on. So gynecomastia, or male breast tissue, is one of the more common things we do for male patients. So what is it? There's really broken down into a few different variations of gynecomastia. There's the true original sense of the word gynecomastia, where someone actually is growing glandular breast tissue. Oftentimes this can be due to a hormonal imbalance or even previous steroid use. And this is where you feel around the nipple and you can feel this very nodular, dense glandular tissue. And that really needs to be treated with a combination of liposuction, oftentimes with Vaser or ultrasound assisted liposuction that helps break up the fat from that, but then also oftentimes direct excision. So if you don't have any loose skin and you have a previous history of steroid use or a hormonal imbalance, and you just have these really puffy nipples but not too much loose skin, that can all be done with small incisions, doing liposuction, Vaser, and then usually we have to make a small incision at the base of the areola to directly remove some of that glandular tissue that's too tough to be removed with liposuction alone. And so it's a really profound change that can make a great impact on someone. And for people that are in the fitness industry or weight lift competitively, even people take hormone replacement therapy right now, some of the side effects are gynecomastia, and by excising that glandular tissue directly, it really eliminates the needs for some people to take some of those accessory drugs to decrease that risk of the gynecomastia formation, which can have their own side effects. So it's a great option for that. The other group of people that we're doing this type of breast surgery for on men is people that have had massive weight loss. So our massive weight loss patients, it's really called pseudogynecomastia in that case, where it's not just the glandular breast tissue, but it's also just fat that forms around the pecs and the breast area that cause ptosis or drooping of that tissue. And oftentimes, in those cases, you have excess skin that needs to be addressed. And just similar to female breast lift, we have different options for that. Sometimes it's just a circumareolar, or a scar around the areola that we can reduce the skin size. But if you have a lot of drooping and your nipple is hanging below the fold of your chest, sometimes we have to do what's called a double incision to remove that extra tissue. What's different about that compared to a female breast lift, where we're doing the anchor incision, the vertical component, we're always leaving that nipple attached to its own blood supply for a female breast lift. For a male breast lift, to minimize the scarring and to give a more masculine look, we often do this double incision, meaning we get rid of that vertical scar, but how we have to do that is we have to completely disconnect the nipple from its blood supply and actually do what's called a free nipple graft. So we almost treat the nipple as a skin graft. We remove it, we defat it, and we inset it into a new area. So you're going to be left with a scar vertically that outlines the inferior border of the pec, and then a newly placed free nipple graft. And so you'll lose sensation to your nipple, but it's going to give a much more masculine appearance. And again, that's not necessary for everyone who's getting gynecomastia surgery, but it's a great option for the men who have a lot of excess tissue. So it's a really profound procedure. It makes men feel much more comfortable in their shirts and out of their shirts, because it's something you clearly see when someone's wearing a shirt. You can see that fullness up there, And when you go to the beach and take your shirt off, you want that nice masculine look. And then the final thing we can do in combination with that is for men that just have very minimal gynecomastia, or they're just not happy with how everything looks, we can combine it with fat grafting to your pec to give you a more masculine appearing chest by putting a little bit of fat grafting directly into the muscle. This is much different than fat grafting for like a BBL, where we're always staying out of the muscle. For the chest, it's safe to actually put some fat directly into the muscle to help redefine the shape of the pec, give you that upper pec fullness that really shows like you've been hitting those incline bench hard. And it's a great option for people that want to refine everything, and this can be combined with different cases. We can do this with a tummy tuck or with just a liposuction, for ab definition and all that kind of other good stuff we can do for men. This can all be combined together. We got great options for you. So any guys out there that are looking, or the husbands of our other patients, come talk to us and we'll be happy to help you with your surgery as well.
Can I start with the questions?
Yeah, let's do it.
Okay, this is a comment from Kay. She said, here to say I'm 6 weeks post-op today from a procedure with Dr. Wigriff, and I couldn't recommend his work enough.
Awesome, thank you so much, Kate. I really appreciate it.
Okay, we are here on TikTok now. Are you in New Mexico?
I am not in New Mexico, but I did my plastic surgery fellowship in New Mexico. That's where I have the Zia on my hat from.
Oh, that's why. Okay, but we can tell where we are now.
So we're in Miami, Florida at Pure Plastic Surgery. Come check us out at pureplasticsurgery.com, but I do have some ties to New Mexico.
Can I just get a tummy tuck for having 2 C-sections without lipo or anything else?
Just the tummy tuck without lipo? Yeah, that's definitely an option. For most patients, lipo is typically included with a tummy tuck because it just kind of helps give you more definition and a more refined look. But some patients just don't have very much fat and liposuction is not necessary. And then if you don't want liposuction, you do not need to get liposuction. We do not have to do it. It just may have some effect on your final result being a little less pronounced than it could be otherwise.
Okay, how do you make sure that a tummy tuck patient has curves instead of a boxy body?
All right, so this is very pertinent to our last question. How do you make sure a patient that's undergoing an abdominoplasty or a tummy tuck has that nice curve that we're looking for? This depends on a few different things. It depends on our starting point and our patient and your anatomy. But then so we have to evaluate what we can control and what we can do to improve that. So again, we hit up an abdominoplasty from multiple different angles to try to maximize the result. So what does that include? It includes removing all the skin and fat from the lower abdomen, usually from about the level of the belly button down to above the pubic area. That's gone. We do liposuction of the flanks. Again, that starts to define that curve a little bit more. And really a big part of it is the muscular plication, or the muscle repair that we do, where we're repairing the ab muscles up from the level of the chest all the way down to the pubic bone. And that's almost causing an internal corset type of an effect. And those things all combined is what gives you that nice, beautiful, curvy shape after an abdominoplasty that's been performed right on the right patient.
How painful is lipo? And please be honest.
So I personally have not had lipo yet, so I can't tell you exactly how it is, but I will say for my patients, the vast majority of them, it's very tolerable. Not to say that there's no pain, and you should expect some pain and discomfort going into it, but a lot of my patients really describe it as having a super vigorous workout and having super sore abs or something like that. And I don't know, Willie.
Yes,
you could probably share.
Yes, I was thinking, and yes, that's the feeling. The first 24 hours you will feel sore, and well, it all depends on what part of the body. But let's say if you have your abdomen with lipo, you will feel like you did like 1,000 crunch the night before. But something with ibuprofen or Tylenol, you will feel better. It's not like unbearable.
Yeah,
No.
it's very manageable, and all of our patients get through it, and they're happy about it. And again, we're doing these all under anesthesia. There's a lot of people out there that advertise minimally invasive liposuction and awake liposuction.
Yeah.
And theoretically, that sounds great, but guess what? It's really uncomfortable to do that procedure completely awake. It's much harder for the doctor to do a thorough, great job when you're awake and you're complaining about little pokes and stuff here. So you're asleep, you're very comfortable during the procedure, you wake up, you go home, you have a little bit of discomfort, but you have pain medicine to manage that.
Okay, this is a patient out of town, and she asked when she can fly back after having a procedure here, and she asked how we'll remove the drains after flying home back.
So great question. We get quite a few out-of-town patients, and so we take the responsibility of your safety super important. That's the most important thing. So we want all of our patients to stay a minimum of 5 days after your surgery. This is really because we want you to the point where you're up, walking around, moving around a lot, that your risk for a DVT or a PE is much lower. And typically by day 5, our patients are in a great spot. They're pretty mobile. It's not a big risk. So you need to stay at least 5 days after your procedure. And then if you have a procedure that requires a drain, your drain can either come out at the day 5 if it's meeting the criteria, or if you need to go home with it, it's not a big deal. We have very clear instructions on how to remove the drains. All of our patients are able to do this. Removing a drain is not painful. Everybody describes it as a funny feeling, and that's truly what it is. You just feel this little thing slurp out, but it's not painful, and all it requires is cutting one small stitch and pulling it out, and it's good to go.
It's cuddles. You will feel like cuddles.
Yeah.
That's the word, cuddles? Like cosquillas? Cuddles? No, it's not that a word? A word?
It's not an English word.
Oh my God. Cosquillas. Okay, Doc.
Right.
The BBL on Lipo 360 use drains?
Yeah. All right. So, do you need drains with a Lipo 360 and a BBL? The short answer is yeah. We like to give a drain for everybody. One drain in the lower abdomen for the first 5 days. And this is a little different than a tummy tuck. We usually leave that drain in for 5 days. No matter what, it comes out at day 5 before you travel home. Whereas a tummy tuck, we're really looking at the outputs to make sure those outputs are going below a certain threshold before we remove the drains. If you are super averse to having drains, it is possible to do a Lipo 360 and a BBL without drains. But what we have to do in those cases is I have to leave all the little openings open so that that fluid can drain out of it. It just ends up being a much messier situation for you to deal with rather than have everything come out of one nice little drain hole. So it is an option to not have any drains left, but then we need to leave everything open and you're going to be a leaky mess for the first few days after surgery, but we have options for you.
Okay, well, how much weight would I need to lose to meet my BMI? I'm 5'3", 196 pounds.
5'3", 196 pounds. I don't have the calculation right off of the top of my head, but our BMI cutoff is 34. I assume you're actually probably under that cutoff right now. But to really get to your goal weight, probably 180 pounds. But come check us out at pureplasticsurgery.com and we'll give you exact numbers on how to do that. All right, everybody, thank you for tuning in. Have a great weekend, and I will see you next week.
Oh, no, this is an important one.
Oh.
If you get only tummy tuck, can it be drainless?
Yes, absolutely. Absolutely. All right, everybody, have a great day. I will see you next week.
Thank you. Boom.